Now we will proceed for our next lecture. So next lecture will be on the practical aspects of MCCD. For this lecture, I would like to call upon Dr. Pratapsingh Rathod, Assistant Professor, Department of FLT, Diva Patil Medical College, Kolhapur. I would like to introduce him. Dr. Pratapsingh Rathod at present is working as an assistant professor in Diva Patil Medical College, Kolhapur. He is graduated as MBBS from BM Patil Medical College, Vijaypur. He has done his MD Forensic Medicine from Al Amin Medical College, Vijaypur. Currently, he is pursuing postgraduate diploma in cyber law and cyber forensics. He has 4 publications in his credit. He has presented papers and posters in national and international conferences. I request Dr. Rathod to proceed for his lecture.
Good afternoon, respected all delegates. Good afternoon, respected all delegates. I want to introduce myself. I am Dr. Pratapsingh Rathod. I am talking about practical aspects of MCCD. In this session, we'll discuss about who is the person responsible for informing the fact of death to the designated registers. We'll also be able to know the person responsible for filling the appropriate MCCD form for cause of death in different scenarios, and also steps to be taken in death certification for out of hospital deaths. Legal provisions of MCCD. MCCD is a mandatory as per registration of death and stillbirth in India under 1969, sorry. And submission of MCCD to local register is obligatory under rule number 7 of Maharashtra registration of birth and death, which was revised in year 2000. It is done as per the occurrence of event where the death has occurred. The person who is responsible depends on where the person has died. In cases of hospital deaths, medical officer in charge of that hospital or emergency room in charge has to inform the register about the death. In case of institution deaths, like in case of any hostel deaths or jail wardens, jails, or any institution, if there is a death, the in charge of that institution has to inform the register about death. In case of home deaths, head of the house has to inform the register about the death. If the death is in village, then he has to inform ANM, ASHA workers or Anganwadi workers, or in case of town or city, he has to inform the municipality officers or registrar about the death. In case if the person has died in moving vehicles, like in car, airplanes, ships, or any ambulances, the person who is driving the vehicle or who has caused the accident or who is the person in charge nearby has to inform the register about the death. In case of public place, death in public places, panchayat, if the death is in village, and in case of town, then the officer in charge of local police station has to inform the register that death has occurred in that area. Time period of informing is 21 days. This is the time limit of within which the death has to be mentioned, registered in the register. Means it has to be informed to the register within 21 days. After the family will get the death certificate after they register, after registration. When the family goes to the register to get the death certificate, it is issued as form number 6. The fee is not charged for this, and if there is a late registration, there is a fee of 2 rupees and up to 30 days. If it is 31 to 1 years, it is 5 rupees fine with the approval of officer in charge of registrar. After 1 year, if that has to be registered, it is 10 rupees fine with permission from the first class magistrate. This is a sample of form number 6, which the relatives get after the MCCD is received. Any death which occurs in the institution, the superintendent or medical officer in charge is bound to notify the government register about the fact of death. After informing only, the register will come to know that death has occurred in the hospital. Depending on the manner of death, the cause of death has to be intimated. For example, if the death is natural, then the superintendent has to mention that the natural death has been occurred. If it is a unnatural death is there, he has to mention it is unnatural death. In medical cases, the final cause of death can be submitted after inquiry or after postmortem is done. In natural death, cause of death form, that is form 4 or form 4A, depending on whether it is institution death or non-institution death, must be submitted to the government register by the hospital superintendent by the 5th of every month. So by rules, the MCD has to be mentioned within 5th of every month. And this has to be done by attending physician. The cause of death has to be issued. In ordinary cases, if death is in hospital, the MCD is issued by attending physician. Any attending physician who is attending that cause, attending the patient, has to issue MCCD. And it has to be issued based on the information available, whether it is natural or unnatural death. If it is a medical error case, it can be filled later after inquiry or after postmortem is done completed, after confirming whether the case is medical error case or normal case. In broad death cases, the situation changes. In broad death cases, if a medical error case is a medical error case, MCCD should be issued after autopsy or inquiry is done. In natural death and broad death cases, if the patient was treated in the same hospital, means the patient was admitted in the previously, he was discharged, then he was again after a few days was brought with complaints, and during travel or during the ambulance he has died, then it becomes a non-institution death. Then the physician who has been treating that patient in that institution has to issue the form 4A. So form 4A will be issued in this case because since the patient is not admitted in the hospital. If the person is brought dead as a fresh case and it is a natural death, then the family physician who was treating him has to issue the MCCD in form 4A. Or in some cases, if there is no treating physician, then civil registrar should then the civil registrar will assign a physician to issue the MCCD form. This is a part which the relatives get in the form 4. In this as we see that this part only mentions that has occurred. So cause of death is not mentioned in this part. This avoids the information about the cause of death to the relatives, so that some private case, some cause of death may not be known by the relatives. For example, if the person has died because of HIV, the relatives may not know about cause of death. So to avoid that, the detached part of the MCCD only consists that death has occurred. Use of MCD in relatives. The MCD after they can use that to produce a cemetery or crematorium or burial for cremation purposes. Show the government register to get form number 6. To get form number 6, that is death certificate, the relatives first has to go to the registrar. In that register, they receive form number 2, which is a death report. From form number 2 and MCCD form 4A, the detached part of form 4A, 4 or 4A, they go to the government office where they get the death certificate, that is form number 6. So this is a performer of death report, that is form number 2, which is issued by the birth and death registration department, let's register. Form number 4A by medical officer in case of in-home deaths, medical officer who is in the PHC if it is a rural area, or family physician or medical officer in charge authorized by municipality or hospital where the patient has been last being seen has to issue the form number 4A in case of home deaths, mainly for terminal illness cases. So this is lastly, we'll discuss about some examples of medical cases, like if there is suicide, accident, death by drowning, death by burning, scalds, fires, explosions, certain deaths of children by death in infancy, death of the foster child, death in case of suffocation of certain deaths, then death arising out of use of vehicles like from bus, lorry, train, aircrafts, death involving fault or neglect on the part of another person, or death due to violent, suspicious, or unexplained cause, death due to poisoning, so suspected poisoning, including by prescription or non-prescription drugs, other substances, or any gas or solvent fumes, death as a result of medical mishap, or death in legal custody. These are the few examples which has to be mentioned as military cases. These are my references. Thank you.
Thank you, Dr. Rathod. Thank you, Dr. Rathod. You have explained about the persons responsible for informing the designated registers about the death. Also, you have informed about what is the time period for informing the death, that is important, and death intimation in medico legal cases.